Welcome to Ask Your Doctors. Welcome to another Wellness Wednesday. In case I'm looking a bit more relaxed than usual, yes, I'm coming to you from the beautiful city of Durban. Yes, we ran away from your load shedding. I couldn't handle stage 6 anymore. And just towards the end, until the end of July, I will be trying to shoot as much from Durban as possible. And by coincidence, we have one Dr. K to another Dr. K because today we welcome dermatologist. Okay, she welcomes us to Durban. Yes, how are you, Doc?
I'm fine, thank you. Thank you for having me in
Thank
your
you for
show.
welcoming us.
Yeah.
In case you're wondering what I mean, it's Dr. Nokubonga Khoza, and she's a dermatologist from Durban, and we are glad to have you. So, Doc, thank you for having us in your city,
Ngiyabonga kakhulu, and welcome to Durban.
where there's no winter at all.
Yeah, but I mean, this is our winter.
It's the best winter I've had in a long time.
Kuba njalo vele thina siyagodola, and then abantu abavela ngaphandle, they feel that it's warm.
No. Thank you for having us. And Doc, dermatology. Now and then we would like to, we aspire to inspire the young ones. So what we do is we say, please tell us your background, how far back it goes. And if it goes very deep into rural, it's even better because we want to, we aspire to inspire those young ones that come from rural areas that think they can never turn into anything at all. So dermatology, where do you come from and why dermatology?
Igama lami Nokubonga Khoza. I was born Mlazi, which is a big township in Durban. And I grew up kwa AA section, and I studied most of my primary education there. And then obviously I left the township during the years of transformation, and I studied in a school called Durban Girls House School. And then from there I went into medical school here in KwaZulu-Natal. I come from a family of 4 children. I'm the third, and I think just like everybody else, we all come from hardships. So I also come from hardships, and which most black families experienced. But I was raised well. I was raised with humility. Our parents, and I'm sure yours as well, they believed that the only way out for us was to teach us. So a lot of money and a lot of time went into my education. I then went into medical school. Obviously, I went into medical school during the period of transformation where being black...
Around which years?
Yes,
90...
around the 90s to early 2000. And so there were a lot of opportunities for us as black individuals to kind of move in the direction that we wanted to. So we were given that opportunity. And I appreciate that time because I don't think I'll be here if I had not had the opportunity. So I went into dermatology because of my love for dermatology, but because I was also handpicked into the discipline. I started practicing or experiencing with the skin in my 4th year of study. I was involved in research as an undergraduate student. So by the time I qualified, I kind of knew that this was the field that I was going to go into. And mainly because, you know, at that time, there were very few black dermatologists, very few female black dermatologists. And it bothered me that majority of people in South Africa are black, yet we have very little understanding of how black skin behaves and how we treat our own skin conditions.
Okay, awesome. Let's say now we want to inspire 1 or 2 young black female dermatologists in the future. What would you say to them?
I would say medicine is tough, but we love it. You know, if you've got the hearts for people, if you've got the hearts for helping, and you can push through, I would say go for it. And I would say dermatology is a wonderful field. I mean, I love it. I live skin every day. And skin issues are very important. We all know that skin color is always going to be a topic of discussion. So for me, I always say push through, work hard. The field of dermatology is huge. There's so few of us. We're always open to welcoming new faces, especially black females, because there's so short of us. So if you love it, you go for it, you study hard, and the opportunities are there, and we are there. and we are there to welcome.
And we'll be inspired by their success.
Of
As
course,
we are
of
by
course.
yours.
Yes, yes,
Yeah.
yes.
Today's topic, Doc, is we're talking about acne.
Yeah,
Different
induna.
types of acne. Can you give us briefly?
Okay, so acne, most people will say induna. That's the term that we use all the time.
Okay.
And so induna or acne are these pimples or bumps that you see commonly ebusweni. There are different types of acne. So we as dermatologists will look at the skin and will try and describe the lesion that we are seeing. So when we talk about acne, we talk about non-inflammatory acne, which is dominantly what we call comedonal acne. People will know blackheads, what we call blackheads or whiteheads. And that's the type that I commonly see in teenagers. Not that we don't see it in adults, but non-inflammatory acne is usually seen in the younger age groups. And then you can then get inflammatory acne. So now you've got the blackheads, the whiteheads, and you start having these big bumps. Some of them may have pus, we call those pustules. There may be irritation of the skin, there can be nodules, big abscesses. That falls under inflammatory acne. We can also look at acne in terms of how severe. Sometimes we'll say, you have mild acne, you have severe acne, and that is usually based on how many pimples we see on the face. But also, sometimes acne, you can have different types depending on what's causing it. So the common form of acne is what we call acne vulgaris. That's what everybody has. But people sometimes may experience steroid-induced acne. So some women and men may be applying creams on their face, and those creams may lead to acne-like lesions. You may also get acne from certain hair care products, and we call that pomade acne. So if you're using a lot of oils in your hair, you may start having pimples on the temples and on the forehead, and we call that pomade acne. So there's different types of acne depending on the nature of the lesion. So you get non-inflammatory or inflammatory, and also depending on the cause of the acne. And lastly, sometimes we have a type of acne that we call hormonal acne, which we see mostly in females, and it tends to affect the lower part of the face.
And hormonal, anything to do with puberty?
All acne is hormonal. So I always say all acne is hormonal because what drives pimples is overproduction of oil. And what drives overproduction of oil is hormonal fluctuations.
So that's why we see it commonly during puberty.
So you will see it because obviously that's when you have androgen excess or hormonal. That's your period where your hormones start acting up. So yes, majority of people with acne are teenagers, but everybody can suffer acne, all ages. I see it in adults. I see it as late as 60 because it coincides, especially for women, every single month your hormones are behaving, all the time with your periods. And that also happens later on in life. So you can have acne late into your 50s. Commonly also, again, we talk about adult onset acne. Women will come to me and say, I had perfect skin as a teenager, and all of a sudden I'm breaking out as if I am a teenager. But that's because most and all acne is usually hormonal.
You can tell I see a bit of it in my house because I'm
sure you have children.
Yeah, in that age group. In any case, Doc, before we move away from this one, child acne?
Yes. So what normally happens is, I said acne affects all ages, but sometimes we may see acne in the neonatal period, so that is in the first 6 weeks of life, or we may see it in the first year, between 3 to 6 months. So if it happens in the first 6 weeks of life, we call that neonatal acne. In the first year, we call that infantile acne. There's really no clear understanding of what causes that, but we do think that, especially in the neonatal phase, it may be maternal, hormonal transmission, or, maternal hormones still circulating in the body of the baby, and that may cause maybe overactivity of the sebaceous glands, which we do not expect at that age, and that may result in pimples. Or sometimes the skin, we know that we have these bugs or commensals that sit in our skin which are normal, but sometimes they may overpopulate or overgrow and lead to acne kind of lesions. The important thing though when I see kids or babies with acne is that we shouldn't dismiss anything as pimples at that age. What you want to know is this true acne in a child, or is this a form of infection? Because you can get infections that will appear on the face just like pimples.
Okay, you say in babies between, say, 6 to 12 months, how do you treat it? It sounds like it could be very difficult.
So sebaceous glands are oil glands. So the skin has these oil glands that are important because for moisturizing of the skin, you need oil.
Okay.
So you'll find a lot of sebaceous glands on the face. Anywhere where you've got hair, you'll find these oil glands along with the hair. So you'll see them on the face, on the chest, on the back, even in the thighs and even in the buttock area. So the way that the skin moisturizes itself is using sebum, which is a form of oil that is found in the sebaceous glands.
And child acne rather, sounds like it could be very difficult to treat, considering you can't use any other products you wish to use.
Yes, I think it's difficult to treat, or it's challenging because it's the stress that it causes to the parents. But generally, it's self-limiting and it will sort itself out. So we don't go hard with treatment in that phase because most acne treatments are very harsh and you don't want to cause damage to the baby. So I always say to mothers, just watch it. Make sure that you're using very gentle cleansers, gentle moisturizers. The moisturizers have to be light because the baby is still young. It's very difficult to regulate things like temperature as well as oil. So you want something that's very light, that's not going to occlude the pores and worsen, the formation of pimples. And when all else fails, then you can, take your kids to the dermatologist or the pediatrician. And sometimes we do use certain acne medication which we apply to the skin, but it's under a controlled environment. So generally at home, I would say keep it clean, keep it very light, don't pop pimples in children, and don't use over-the-counter stuff that has not been approved by a doctor.
So pimple popping not...
Definitely not in that age, or at any age.
Okay, so definitely not. Any reason?
No.
Any reason?
Because you cause trauma to the skin.
Okay, I know what you mean.
Yeah.
Yeah. Okay. You already spoke briefly about ladies complaining about acne. Any more you can give us on adult acne?
So adult acne is very common. It's actually one of, and it's becoming more and more common now. And so typically, women will experience breakouts, maybe from the age of 25, in their early 30s, and late into their 40s. And it's directly related to hormonal fluctuations, in the sense that things like maybe stress, things like maybe diet, things like just hormonal imbalances may push your hormones towards androgen excess, and that then causes overproduction of the oil, and that leads to acne. So it's a very common form of acne, although it's traumatic and people just get shocked. And we'll see that in terms of its distribution, in that hormonal acne affects the lower part of the face. So it's acne that's along the jawline, the cheeks, very deep lesions, big, and they leave a lot of scars.
And does food ever have an effect on...
Of course, because the skin doesn't work in isolation.
Okay.
There's many myths about food. People will tell you, I ate a chocolate and I broke out. I ate peanuts and I broke out. But in terms of the evidence for it, we know that food that raises your blood pressure, your blood sugar, food that have high glycemic index, sugary foods, starchy foods, junk food, overly processed burgers, chips, all of those, they can cause acne or worsen acne. In fact, I mustn't say cause, they worsen acne.
Yes.
And then we've also looked into dairy products. So some dairy products like milk, not full cream milk, but low-fat milk, as well as skim milk, has been shown to have some effects on acne. And the reason for that is because of the hormones that they use when they're preparing those.
Okay. We went to the streets of Durban, and this production wouldn't be anything without the people of the city. Let's hear what they had to say.
Dairy products like low-fat milk as well as skim milk has been
Dokotela yini ekhoza induna? Cela ukubuza ke.
My name is Mufudzi. I once had a skin infection when I came from Cape Town to Durban, and I was told that it had something to do with the temperature changes. It was just like a rash on my elbows and my knees. It cleared up on its own, but I just wanted to know any ideas of maybe temperature related or climate related skin conditions. Yeah, thanks for that. If you have any answers for that, yeah.
Welcome back, guys. We are still hanging out with the other Dr. K from KZN. There you have it, Doc. Bayabuza Bantu.
Yeah. I think we had 3 questions.
Yes,
yeah.
Doc.
The first
I'm hearing
question.
the word induna a lot.
Yeah. The first question was ubaba obuza ngokuthi induna zibangwa yini.
Yes.
So induna we said is acne, and in terms of ukuthi zibangwa yini induna, most of the time induna can be genetic. Kukhona abantu where you find ukuthi induna they are in their families. And then also induna can also be hormonal. Njengasikhulumile ukuthi you see it mostly kuma teenagers because of puberty, or mangabe abantwana bengena kwisigaba so khula. And then ezinye izinto would be, as we said, creams or izinto abantu abayigcobayo ebusweni which can block pores, and then from there you get pimples. Okunye, it's mainly sometimes abantu they scrub their faces. I mean sikule where you have to excessively scrub your face. I don't know why, but maybe we were trying to clean ourselves or maybe reduce the oil. But excessive scrubbing or using harsh things on your skin can actually cause induna again. So there's many causes of induna, but at the basic of it all, it's genetic factors, it's hormonal factors, and some of the skincare products that we are using on our face.
Okay. And the scarring?
So there's a lot. When we treat induna or when we treat acne, the main reason we want to treat acne quickly is because we know that acne scars, and the scars of acne are lifelong. So there are different types of scars from acne. Sometimes we talk about post-inflammatory hyperpigmentation. So you can have a pimple and it leaves a mark. So the mark on its own is a form of scar. So you can have dark marks or light scars. And then induna, when it's a lot, especially, remember I spoke about inflammatory acne. So when you have inflammatory acne, the actual inflammation destroys the skin. So there are 2 layers to the skin. You've got epidermis, which we don't see, and then you've got the epidermis, which we all see. So sometimes inflammation is so much that it actually destroys the epidermis and you lose the epidermis, and so it thins, and we call that atrophic scars. So it's those people where you see they have imbobo or holes and pits on their skin. So that is what we call atrophic scars. So there's types, there's pitted, there's box, some of them look like box, some of them are rolled scars, but sometimes kubantu bamnyama or in anybody else, when you get trauma, inflammation, the body actually over heals itself and produces more skin tissue, and so you make it overproduction of collagen, and we call that keloidal scars. So abanye babone benamaqhubu, like these scars that are big, we call those keloids. So the treatment of acne scarring is to address and treat induna before it even scars you, because once it scars, very difficult, and it will depend on what type of scar. So if it's a pigment or pigment changes, we can use topical things, izinto that will lighten the mark. But once it gets atrophic, very difficult because we've lost the skin. But we can inject, we can do procedures on the scar. And if it's a keloid, sometimes we can inject it, but very difficult to treat.
Before we get to the other areas of the body where you can get acne, does tissue oil ever mitigate or lessen the damage of the scarring?
No.
Okay.
Tissue oil in itself.
You're dashing my hopes.
No, tissue oil. Oiling the skin or using things like tissue oils to treat scars really doesn't work. There is something in using oils in that they're good for moisturizing and hydrating the skin. And when the skin is well hydrated, it does heal, well, but it will not treat scars.
Okay. And now tell us about the rest of the body areas where you can find acne.
Yeah. So you can find acne commonly on the face, but remember we said acne is a condition that affects the pylo, which is hair, sebaceous units. So anywhere where you see hair and you've got the sebaceous or the oil glands, you can get acne. Common areas: chest, we see a lot of chest acne. Back acne is really a problem because it tends to affect, the entire back. People can't wear their skinny tops or whatever, but you can also get acne along the arms. You can get acne on your bums or in the buttock area. You can also get acne kind of lesions on the thighs. So anywhere where you've got hair and oil glands together, you will break out.
Okay, Doc. There's a difficult word for me to say here. It's rosacea. Did I say it right?
Rosacea.
Rosacea.
Yes, you did.
You get it there.
Yeah.
Okay. What is it and how does it differ from acne? Maybe as long as you tell us what it is, we can tell how it differs from acne.
So most of the time, it's actually very difficult to differentiate, for a normal person to differentiate between rosacea and acne. And the reason for that is that they affect the same area on the face. So rosacea is a condition, it's a chronic inflammatory condition of the skin where there is abnormal functioning of the barrier of the skin as well as the vessels or the vascular part of the skin. So people with rosacea will present with pimples. And sometimes these pimples or these bumps may also have pus. So just like acne, so you get pimples, you get these pustules on the face, but they're commonly on the central part of the face. So people with rosacea will have redness, which is the main symptom, and redness sometimes is very difficult to see on black skin, but generally, classically, rosacea will present with red skin, sensitive skin, and then you've got pimples and pus on the center part of the face. And when we were talking about acne, I said one of the most important lesions of acne is what we call blackheads or comedones. So people with rosacea will not have comedones, which we see in acne. Not only does it affect the face, but rosacea can also affect the eyes. So you can you can have facial flushing, pimples and pustules, but you may also get eye involvement. So they may have redness of the eyes. And it's really individuals who will say, I have sensitive skin, whatever I use on my face, it burns me, it stings. And sometimes there'll be triggers like if they drink alcohol, the lesions worsen or they get the redness or the flush. If they drink coffee, if they're upset, you get a breakout. So they can affect the same areas of the face, but it looks different.
Any 3 tips you want us to take home?
So firstly, acne is a chronic condition. And for me, I always say, treat it early so that you don't scar or prevent scarring. And also, acne is not caused by dirty skin. It's not like your skin is dirty or there's something abnormal in your body. It's purely related to genetic influence as well as hormonal abnormalities. And lastly, when you have acne, you want to use as gentle products as possible. So
Yes.
the thought of using harsh things that burn and sting is actually wrong. You want to go for more gentler products that are nourishing and that help you repair your barrier.
Okay, that's your tips, guys. Take them home. And now tell us, let's entertain the interesting part of the show, myths.
Yes.
Now, love-based talk.
Love-based.
Love-based, that
love-
someone has a crush on you, or you have a crush on someone when you have a lone standing pimple.
Yes, I know. We used to call that induna yotando. I actually love that myth, but it's a myth.
Okay.
It's false. But I do like the idea of having a pimple and thinking someone actually likes me. But it's all false. Obviously, acne has nothing to do with love or anything related to that.
Okay, so in boys a certain age
Yeah.
of a certain age where they are now allowed to do adult things, some boys would mock a boy with pimples, but it's a sign of lack of intimacy and loneliness. How true is that?
Definitely not true.
Serious talk.
Not true.
Okay.
Not
so,
true.
so there's nothing else to say about it.
No, not true.
Okay, and let's talk about the pimple popping myth. You already said something about it. Now you can tell the viewers,
Yes.
I mean, the real story of pimple popping.
Yeah. So don't pop your pimples. And popping pimples does not cure acne. What popping pimples will do, it will actually cause scars, whether it's pigmentation, but popping pimples can also cause atrophic scars like pits or dents in your skin. Because when you pop a pimple, you actually spread the inflammation to deeper tissues of the skin. So I know it's nice, it's gratifying, it always feels good, but we always say do not touch your skin, do not pop your pimple.
All right, just give us 2 facts then, Doc.
About acne.
Yes.
So acne is chronic, it's caused by hormones, it's not related to diet or anything like that. It's a medical condition and it should be treated medically.
It's been a pleasure, Doc.
Thank
Before
you.
we let you go, please tell us where people can find you.
I practice in Durban. I practice at eThekwini, the Heart Hospital, which is in Newlands along the N2, and that is where I have my offices and
the
practice.
socials?
My socials, you can find me on Instagram at Dr Nokubonga Khoza Derm, and also on Facebook at Dr Nokubonga Khoza Dermatologist.
You can also find Doc under the section that says find a doctor on the website. And if you are interested in advertising on our show, in case you think our brands align, please use the email address listed on the screen, or else you can just throw us a DM on Instagram or Facebook. Doc, it's been a pleasure having you. Until next time, guys, please ask your doctors.